Right. Good evening, ladies and gentlemen. This is Katyayani, and I welcome you all to this very special panel discussion on the topic the patient experience with breast cancer prognostic testing. We would like to thank Zydus for helping us put this session together. Join me in welcoming our distinguished panelists for today. We have with us Dr. Shefali Desai, Director and Chief Consultant Breast Surgeon, Samved Hospital, Ahmedabad. Thank you so much, Dr. Shefali, for joining. We have with us Ms. Neerja Malik, who is a cancer counselor, author of I Inspire. She also runs a podcast called I Embrace, and she is an inspirational speaker for all our survivors out there. Welcome, Ms. Neerja. It's a pleasure to have you.
Thank you. Thank you very much.
We will
Um,
also be joined by Dr. Chithrathara K, who is the HOD Gynaecology and Surgical Oncology from VPS Lakeshore Hospital, Kochi, and Dr. Kanchan Kaur, Senior Director, Breast Surgery, Medanta, the Medicity, Gurugram. They'll be joining us in a bit. The panel would be moderated by Dr. Anil Heroor, Consultant Oncology, Fortis Hospital, Mumbai. They'll all join us shortly. But before we begin the Q&A round with our experts, I'd like to invite Ms. Neerja to share her incredible journey with cancer. Ma'am, please, if you'd like to share your story with us, it'd
yes,
be
but
wonderful.
thank you. But I don't know if I can be seen. I seem to have gone off the air somehow. Can you hear
No, we
me?
can see you. We can see
You
you.
Yes.
can? Okay.
Yeah. And hear you
So,
too.
and hear me too. Okay, so there are a lot of things that have cropped up, but here goes everything. So, first and foremost, the divinity in me bows down to the divinity in all of you. And I have been playing a lot of roles in my life, but those that are of real importance today are that of, as mentioned before, a cancer conqueror, cancer counselor, and cancer caregiver. So, what I would like to say here, because I know that everyone is aware that this month, world over, is the Pink Ribbon Month to spread awareness and prevention and cure of breast cancer. Now, I was diagnosed with left breast on Friday, the 13th February 1998, and then right breast in 2004 November. I do realize that when someone is diagnosed, it can be a very shattering and terrifying experience. So, guess what I do? I like to demystify, I like to simplify everything. And this is what I tell all my patients, who later on, of course, become dear friends of mine. So I tell them that, okay, we're meeting today, and you and I have formed a rapport. So if we meet at a mall, and I see you and you see me, suddenly our faces will light up. We will welcome each other. And like the Dilliwala says, we will do jappies and exchange puppies. But this is what I want you to be when you welcome your treatment. So, as far as breast cancer is concerned, they say that we are the luckiest as far as all cancers are concerned because it is literally an outer, out of the body experience. So, when people get very upset, I just give them a simple example that we have an apple, the apple gets spoiled from somewhere. You take a knife, You scoop it out, you tear it, chuck it, and that's as simple as describing the removal of a malignant tumor from a breast with the correct margin around it. So I tell my patients that guess what? You're cured. And they say, okay, if you're cured, why do we have to go through chemo and radiation? So, very simply, I say that, my dearest ones, if I buy a gift for you, am I going to just come and hand over the gift? No, I'm going to put the gift into a box, perhaps, wrap it up nicely, tie a pink ribbon around it, and then give it to you. So, what are the three things that are very important? A surgery, chemo, and radiation. And my way of simplifying everything is that the surgery is the gift, the cure. The chemotherapy is the wrapping paper, the box, and the radiation is the pink ribbon. Now, why do I say this? I tell them that if you welcome your treatment of these three aspects, as you welcome me when you see me, and I welcome you, imagine your emotions and your mind is welcoming the treatment. So, therefore, your body is obviously accepting it, and the body will benefit completely with the way you are welcoming your treatment with the grace of God, and you are able to overcome and conquer it. So, this is the simplest way of doing it. So, when I was diagnosed, I ran to my father and I said, Papa, I'm going to fight cancer. And this is what the captain of the ship explained to me. Beta, why do you want to fight it? I thought he would be very proud of me. And I was taken aback. I said, then how do I feel? And he said, when you fight something, you are being negative. You say that you're going to kill that person, destroy that person. All kinds of agitated feelings come up. So I said, what do I feel? How should I feel? And 25 years back, when I was diagnosed, and since when I've been counseling cancer patients, not necessarily only breast, 25 years back, my father said, face it, don't fight it. So these are a few points that I would like everyone to keep in mind. Imagine 25 years back how things have shifted. We've come abreast of the whole world, if not better, in terms of surgeries, in terms of chemotherapies, and in terms of targeted radiation too. That was not in my case. It was just cobalt. So please remember, I always feel that doc is God and God is doc. And I think I would now hand it over to Katyani and to Dr. Shefali to take it from there. And thank you very much for patiently listening to me. God bless all of you.
Thank you so much for sharing your story, ma'am. You are an inspiration, and it is wonderful listening to you. Uh, Welcome, Dr. Anil. We have our moderator with us who will be leading this session. Dr. Anil, thank you so much for joining, and I'd like to hand over the session to you now. Other
Thank,
speakers are joining in a bit, but we have Dr. Shefali and Miss Neerja for now, so we can start the session.
yeah, thank you, Katyani, and thank you, Madam Malik. It was so inspirational listening to you. My video was not on, but I was listening to you all the while, and I think it is patients like people like you who are actually providing this great inspiration to all the patients who come in. I always tell everybody that it's very easy, when for a patient, when they listen to a doctor, however good or bad he may be, they still don't get that confidence that a patient can give them. And when people like you come forth and talk about it, they inspire in two ways. One is that the patient gets inspiration that if he can do it, I can do it too. And the second thing, it removes the taboo about cancer, and that I think is the biggest contribution of people like you. Hats off, ma'am, and thank you so much for sharing
Thank
your experiences. Thank you so much. Uh, I think Katyani, with should we start? I think, or we wait?
So we can start the session.
Yeah, I think. Hello, Dr. Shefali.
Hello, Dr. Heroor. It's good to see you.
Thank you. Same here,
I
and
don't
I
mind
think
waiting because there are other 2-3 people who would like. Otherwise, there won't be a panel discussion, I guess.
that's fine. I think since we have limited time, I think we can just start off, and then let's see how it goes along. If you're okay,
Yeah, absolutely. Can I just take 2 minutes for congratulating
please.
Neerja ji for her wonderful and inspiring talk? As Dr. Heroor rightly said, I think when the patient talks with and gives inspiration to the other patients, this is so much better than us. Because sometimes, what we say is more of academic or what actually the treatment is, but what you go through is and what you convey to others, I think that matters the most. And I was reading that you have authored a book and you are also an inspirational talker, you're a motivational speaker. So I think someday I also do a lot of breast cancer awareness talks, and we have an awareness walkathon every year. This is going to be 11th walkathon on 3rd of December. So if I can connect you on Zoom, it will be great. It will be a great inspiration to other patients of mine, because that is an event where we also facilitate them. We also make them talk so that the others are inspired to not only fight the disease, but others are motivated for a checkup. Because most of the times the women don't get ready for even the routine screening checkups.
May I take just a few more minutes while we are waiting for the people to come? So I just want to say one thing, that in 2008, the Department of State, US, had invited me for 21 days. We were 14 or 15 people from around the world. It was an international visitors leadership program on breast cancer, the first ever. And it was, of course, in the month of October 2008. Now, that was the first time I came across this word, patient navigator. And I was very impressed. We went to 6 cities and went to the best hospitals and saw the latest stuff happening there. Then, in this huge audience of a couple of thousand people, I just asked one thing. I said, all right, so you talk about a patient navigator, you talk about social worker, you talk about counselor, you talk about the liaison between the doctor and the patient. I'm all of these things. And then one more question, please. What happens after hours? So they all looked at me and they raised their eyebrows, and one of them stood up and said, well, it's 1-800. So that's when I turned around and I said, well, I'm all these things and I'm also 1-800, because I've told people to call me day or night, because the patient is most traumatized in the night when the family is asleep. And who doesn't want to wake up the family? The patient feels that I am a burden. So I told them, and they were stunned, because I said, I tell my patients, please call me anytime. I might be asleep, but I'll wake up. And I can talk either for 2 minutes or 20 minutes or 2 hours. You will understand the situation. You will go to sleep properly. I will definitely go to sleep, and we will all be at peace. So I think that compassion, that love has to come from deep within. And you're right, Doctor, when you said that they say that if you can do it, so can I. That's the ace up my sleeve. That if I can do it, so can you. So I always tell patients that, in your locality, you conquer it, you overcome it, hum honge kamyab. In your locality, you will be the dada or the dadi that everyone will come flocking to if there is cancer in their families. And whatever you see, the way I talk to you encourage them, talk to them, and ripple after ripple, the whole world will be a better place just for this. So thank you for giving me extra time, and I love to talk, as you can see. But God bless you. Thank you very much.
Dr. Anil, we can start with the questions, please.
Yeah, sure, sure. So I think, Dr. Shefali, I think we'll just start off. I think otherwise it will get too late.
Yeah, that's true.
So I think basically, as the thing about as we were discussing, one of the biggest anxieties that a patient faces whenever a diagnosis is made. The next question is that how well will I do? How much time do I have? And I'm sure all of us as doctors have gone through that question. It is written large on the faces of patients, and that is something that we need to really. It's very difficult to answer. Nobody of us is a perfect Jyotishi, even if we knew Jyotish. And nobody can really predict about what can be done. But now, as we know, there are various prognostic tests that are available. That is various the tests that are available to know what is the kind of what are the chances of recurrence that may happen, and hence that has probably made answering this question a little objective more than anything else. And that is why we need to discuss about these tests that are available. So, Dr. Shefali, I just wanted to know, can you just walk us through what exactly goes through this typical question? How do you handle it, and how do you how do they take the recommendation for prognostic testing whenever you tell them about these tests?
Yeah, I think it's a very good question, Dr. Heroor, because as consultants, we face this question off and on. But I think chemotherapy is a very, very, the patient is never worried about the surgical part. The patient is always worried about the chemotherapy. Even, see, I'm a surgeon, but still people will always ask me about chemotherapy. So when you tell them that you are going to do a test which is going to say that you might not have to take chemotherapy, I think it really makes them happy. The only glitch is the cost factor, but I think with the Indian test, that factor is also taken care of. Some of them, yeah, they take a little while to understand why the test is being done and what exactly is going to happen, what exactly it's going to read. So once you explain them into detail that this test is going to tell you that if you are at a low risk of occurrence, you don't need to take chemotherapy. If you are in a borderline or high risk, you may have to take chemotherapy, but not the usual chemotherapy. But since it's an early case, which is a very important aspect, that we offer this test or we recommend this test only in early stage cancer. So then actually they're happy about it. So honestly, I think once you recommend the test, as I said, except the cost factor, they take it very well.
Absolutely. I think that is one big thing that is always asked. Once, this reminds me of a funny moment I had when I was giving an awareness talk. So in the end, I just said, any questions? So one lady got up and said, Doctor साहब, आप जो कीमोथेरेपी देते हो, उसमें क्या आप एसिड डालते हो? हमने सुना है कि उसमें एसिड डाला जाता है. So it is that kind of fear that
That's
तो
true.
शरीर
Yeah.
जलता है, सब जलता है, तो एसिड डालते हैं. मैंने कहा माँ जी हम बाथरूम धोने के धंधे में नहीं है, हम कोई एसिड का इस्तेमाल नहीं करते. So that is the kind of fear that patients have about chemotherapy. And definitely I think prognostic tests have made that easier. As you said, yes, we also have a very big issue about costs. India, for all its progress that it has made, we must remember that we are still a low middle income country. We are not, our lot of our patients are not covered by insurance. And secondly, some of these tests are also not covered by insurance. And that is one of the big drawbacks that happen. Though some especially can assist sometimes does get covered in few of my patients when they present it well to the company. So that is it is of help that way. And I think in not only Indian pharma, Indian diagnostic center and diagnostic companies have made life definitely a little easier for patients and clinicians as well. So the next thing that comes is when we discuss this prognostic test. What is the kind of what do you emphasize on? From a scientific perspective, how do you look at the say a Indian can assist test or as compared to the standard available in literature, which is included in guideline? And how do you emphasize the importance to the patient? So as a clinician, how do you value it? And as a patient, what do you think that they find important?
Yeah, so whenever normally I talk to a patient, as I said, we always explain that the test will help you to say the risk factors and that you might not have to take chemotherapy. So one more fear of chemotherapy before I go to actually answer the question is the hair loss. I think most of the patients are so worried about the hair loss in the chemotherapy part. So that is a very important aspect. Ki hair loss nahi hoga to it's very important for them. So now coming to the test, we always give them all the available options. And then, of course, it is very important for us to convince them that the Indian test, which is the can assist, and I use it routinely wherever it is indicated, of course, that it is absolutely comparable. All the sometimes we also need to give them evidence in the educated class, those who have read quite a lot, because they are all aware. Sometimes the cost factor is not an issue. They want to send to the they want to spend money, but then we still give them the options. Ki even oncotype is available, mamma print, everything is available. The test goes abroad, but can assist still gives the same result at a lesser cost. So that mostly the patients get convinced. I think there are a lot of studies also now for can assist by this time to support this. There are a lot of articles also which are there to support that the Indian test is as effective as the oncotype or mamma print tests.
Yeah, that's absolutely true. That is some relief, though I think we do need some more robust evidence that
Yeah,
goes in
sure.
favor, and I'm
Yeah.
sure it will come. So Neerja ji, can I ask you a question?
Hanji, certainly.
So Neerja ji, I was just wondering. From a patient perspective, I don't know when you had completed your treatment, but today we are going fast towards this era of personalized medicine, where you can actually doctor treatment to that single patient. It's something like taking a culture from pus and giving you the right antibiotics. Unfortunately, this comes, the offset is the huge cost that Dr. Shefali was talking about, because the tests themselves are costing so much that, sometimes it becomes difficult for a patient to bear. So question number one is, how do you view this? Would you be happier that, that something now has come that we can identify the exact nature of the beast and treat it accordingly? Secondly, this whole thing about losing hair and having these side effects about chemotherapy, does it really affect patient mind so much? I mean, in your numerous talks that you must have given to patients, how do you really view this, and how do patients take it when they first hear of it, when they go through it, and once they have gone through it?
Okay, so I'll start with the second question first. Uh, I must tell you, Anil, that when after my first chemotherapy, I pulled my hair every day. And finally, because I was warned, chemotherapy के बाद तो बाल गिरेंगे, तो I would pull it, कुछ नहीं हुआ. And I said, ये doctors जो है ना, they haven't gone through, they haven't gone through chemotherapy. तो बेकार बोल देते हैं. And look at this, what rubbish. They have no clue. Exactly on the 21st day after my first chemo, I was having a bath to fly to Bombay from Chennai to get my second chemo. And while I was soaping myself, hair. Now, there are two ways. One, you can get shattered, which is true because a lot of people, a lot of women, especially with long, especially Bengali women, Assamese women, who've got the most gorgeous long hair, they feel shattered कि हमारे बाल गिर गए हैं.
And it falls in clumps.
It falls in clumps, and I'm no longer, what should I say? I'm no longer feminine. So what do you think I did? I went to my balcony here. I took my hair, and वो फूल होता है ना? You say, he loves me, he loves me not. So I did the same thing to my hair.
Wow.
Now, how did that idea come? I have no idea how it came to me. But two things happened. One, it made me feel happier because I was thinking of love area and romantic notions. Of course, we all go through crushes early. The second thing is that while I saw it go away in the breeze, I felt as if a weight was lifting from me.
क्या बात है, क्या बात है. That's poetic. Excellent.
Absolutely. So this is what I tell patients. One, कि जब आपके बाल गिरते हैं, खेत अपनी खेत की मूली है. You can shave it off, you can grow it, and let me tell you, अगर आपका मुंडन पहले नहीं हुआ है, your hair will come out thicker than before. So these are the ways. And then I laugh and tell them that मेरे बाल तो straight, but after my chemo, they turned totally curly and white. So I was looking like a judge from the British Empire. जैसे कि मैंने wig पहनी है. You understand? One thinks up of various things to make, as you rightly said, the situation humorous. But there's certain things that go beyond humor, which is we're talking about hair loss. Don't forget the mastectomy, the breast removal. So this lady who was 82, she came from Oman, and she had a pacemaker. She needed a mastectomy, and it was very tough because you know what she turned and told me? She was weeping and saying, "मैं शैतान हूँ." And I said, "Why?" She said, "Allah will not accept me because my body will be disfigured." So you had to go through that. So I explained to her, I said, you know, Allah is all merciful. He loves all his children. And just before she was going into the hospital, into the surgery, I held her hand and I said, Shona, shut your eyes and we will pray. Her eyes popped. Her hands were like birds trembling. I held them and I started off saying, La ilaha illallah Muhammadur Rasulullah. In 10 minutes, her hands were absolutely fine. She opened her eyes and she looked at me and she said, "You are Muslim." Mainu ki farak panda yaar. I said, yes, Muslim. Because to her, Allah had sent a messenger. She sailed through the surgery at that age and she forgot that she was supposed to be a shaitan and she went ahead. So I make the most, somehow God is great. I make the most of a situation and examples come to me. I live them and it just works. So I'm glad you brought up because it's very terrifying to lose your hair, your femininity goes, to lose a breast, again it goes. And I'm a great believer in, what should I say, lumpectomy. Because I always tell them, okay, no doctor, and isn't this true, Dr. Shefali? No doctor will give you a choice. Okay, would you like to do a mastectomy or a lumpectomy? Because if there is no margin, you would not even suggest it. So I said the very fact that a doctor has asked you what you would prefer, think about it. Because a mastectomy means a much larger wound. And a lumpectomy is a smaller wound, it'll take lesser time to heal. So, having gone through all this, I feel that I am able to express things which perhaps a doctor does not have the time to and is not able to convey it. So I'm very grateful that I have, I do what I do and I have been doing it with dedicated passion for the last quarter a century. So that takes
Great,
care
man.
of the second question. And I'm sure Dr. Shefali has something to say also.
No, what you said was very, very correct. That yeah, now we do a lot of breast conservations, and we'll always and always convince the patient for breast conservation. Uh, Unless it's a multifocal or a multicentric disease, which means that it is in different quadrants where we would not like to conserve the breast, or it's a DCIS kind of a situation where we have to do mastectomy. But still, there is a segment of women, because I think there's a lot of illiteracy in our country, that they opt for mastectomy even if we try to convince them for breast conservation. uh, if not the woman, then there are relatives who say, कि नहीं, वो तो निकाल दो. And then I have to counsel the whole family, saying that it is the woman's right to choose the surgery. And then it is the husband's, and then the rest of the people. So that situation comes many a times, even in the educated class, because still the decisions for the medical treatment of a woman are taken not just by herself, but it's a joint decision by the family. And sometimes the others don't understand. They just feel कि निकाल दो तो कुछ भी नहीं होगा बाद में. And then we have to convince them that no, there is an opposite breast also where you can have recurrence. So these kind of situations do happen. And for the hair loss, I also tell them कि आप अगर if you see yourself after 6 months, you are going to look absolutely hot and sexy the way you are looking today.
But
So
Shefali, I want to just interrupt here. You
sure.
were talking about educated people. I consider
Yeah.
myself fairly educated. I have done my graduation in social work and B.Ed and all that. But when I was in Chennai, I was told categorically that I am going to get a mastectomy done. So when my mother said, listen, in Chennai, you have your husband and you have 7-year-old twins. Your entire support system is in Bombay. Come to Bombay, have your surgery, go back, come to Bombay, have your chemo, go back, come to Bombay, have your radiation. I did that. And I have to admit here, in front of everyone, that when I reached Bombay and the surgeon there said that he's going to do a lumpectomy, I wept. I actually went down on my knees, like I was proposing to the man. And I begged him like this and said, please do me a mastectomy. So he said, why? I said, because they were going to do a mastectomy in Chennai. And then he sat with a pen and paper.
Yeah.
He drew the entire breast. He drew the location of where my lump was. He explained to me the fact about the margin around it. And he said that if it was near the chest wall, definitely I would have not given you a choice. But because of the positioning, you can do a lumpectomy. And I said, no, but what if it comes back? This is Neerja Malik talking 25 years back. And he said, there is not enough research done on it that it comes up in the same breast. It may not. And then that's what happened. My left breast was fine, 98. Many years later, in 2004, I got right breast cancer. Now, why? Because we talk about a certain percentage of hereditary. So in my father's side, we have had in 3 generations 43 cases. My dada, dadi, my father, his 2 sisters, a lot of his cousins, I and my 3 cousins. And most of us, the women, breast cancer. So obviously the treatment meted out to me was very, very aggressive. But the fact of the matter is, I am here. And I think that a lot of resilience, power, courage comes from within, comes from your faith in God. And I always say, doc is God, God is doc. You have faith in your doctor and you can overcome anything. And then, of course, I say that support system is important, which is why I was very keen to start a support system for cancer patients, just because I was lucky enough to have a lot of loving family members and friends. And I feel that that is where I fit in. And they easily are able to convey to me their innermost feelings. So God is great that I have this opportunity to do the work I do.
Wonderful, Neerja, wonderful, wonderful. And I really echo that those feelings. You know, I had a patient once who was completely diagnosed, and she came to me and she said, "Doctor साहब, ये treatment 1 साल के लिए postpone नहीं कर सकते क्या?" So I was intrigued. I said, "1 साल के लिए? Why 1 साल? Why that 1 साल?" So the reason that she gave was कि डॉक्टर साहब मुझे बताया गया है कि मुझे पूरी छाती निकालनी पड़ेगी, ब्रेस्ट निकालनी पड़ेगी. You know, they don't say breast, they say छाती. छाती निकालनी पड़ेगी. और अगर ऐसा होता है तो मेरा एक बेटा है, जवान बेटा है और एक जवान बेटी है. दोनों की शादी करनी है और उनकी शादी नहीं होगी क्योंकि लोग समझते हैं कि माँ को हुआ है तो बच्चों को हो जाएगा. You know, the kind of things people think, you think it is for cosmetics. No, it goes beyond that. It goes beyond that. That lady was thinking about her children and she was willing to sacrifice herself so that her children get married, whatever happens to her. So then we could do I told her about breast conservation, which she didn't know. And luckily she heeded that and took treatment. So I think it has really made a huge difference. Personalized treatment has made a huge difference as far as all these the experience of patients is concerned. And I think with this, cancer treatment is changing, and luckily it is really changing for the better, especially in breast cancer. What are the kind of, Dr. Shefali, what are the kind of educational tools that you use? Do you use anything at all, or do you just rely on your fabulous personality to convince patients?
Thank you so much, Dr. Heroor, for those compliments. No, tools meaning, yeah, we use some models to explain them. And as Neerja ji rightly said, that her doctor explained to them drawing things. So I think as doctors, we diagnose the disease maybe in a few seconds or a few minutes. But the rest of the time of the consultation is counseling, because that is what matters the most to the patient. We know what we are going to do. So I draw, I explain to them. Uh, and we have some books, some charts, and some models through which I try to explain to them. Sometimes, when they also want to talk to other patients, I also give them references with the prior permission of those women, so that that gives them more confidence, especially for breast conservation. As I said, many are not convinced, so we have to convince them. We have to convince them for neoadjuvant chemotherapy to downstage and then go for breast conservation. So the patient reference, talking to the patient herself in her own words, like Neerja ji is talking, I think that matters a lot. So I use these kind of tools to convince them. So I think it should be done in practice, and then the patients also have more confidence in the doctor if you do that.
So yeah, I think there are two things that we a lot of times we also use. Is one is whatever guidelines, whatever scientific material is available. I think today we have a lot of Google doctors who come to us, patients who have more information about the disease than the doctors themselves. They come with a huge load of printouts, and then you feel that you're going through a medical viva all over again. So we do have that that handy, especially if someone really wants to know what whether I'm talking out of my hat or is there some evidence to it. That is a useful tool in a lot of patients. Drawings, models, I think really help. A picture says it more than 1,000 words, as so eloquently told by Neerja ji, and that also really helps. I think the last thing that goes a long way is what Neerja ji, madam, you're doing. And support groups are extremely important. They are now becoming more and more relevant. We, in fact, have a support group called Maitri Parivar, and we do the group itself does cancer awareness programs. So, in fact, I sometimes go and listen to them, and I'm completely amazed at the connect that they have with the audience. I'm really held spellbound the way they conduct that entire program, and that helps patients gain a lot more confidence. I also think that the era of personalized medicine is now here. Personalized medicine has made it more easier for patients to know what their outcomes would be, what kind of treatment they are actually going to get, and they feel more comfortable and safe, in my experience, that on the path they are going to tread, and that is the greatest gift that science in the recent years has given to us. With this, I think breast cancer is looking for better days ahead. Still a long way to go, but I think we are getting the measure of the beast quite well. Thank you very much, Neerja ji, for joining us, giving us such a wide experience and such a inspirational talk. It was really lovely listening to you. I agree with Dr. Shefali that we must have you at one of our patient awareness programs if you would oblige. It will be really be nice. Thank you very much. Thank you very much for being here. Dr. Shefali, thank you very much for your inputs. And thank you, Zydus, and thank you, the team of Katyani and Khushbu and Voice of Healthcare for arranging this program. It has been a great evening. Thank you very much. Have a good evening ahead.
Anil, I'm going to just stop you here because I do have the gift of the gab. So I'd like to take just a few more minutes.
Sure.
Yes, this thing about, the prognosis. So I do sometimes, do certain things because they come to me very shattered and they say, ये मेरी stage है, ये मेरी grade है, how long do I have to live? You know what I do? I just say one thing. I said, आप अपनी stage or grade को फाड़ के कुप्पपेटी in Tamil is the dustbin, डाल दो. They said, क्या? And there is immediate relief. So this is how I put it. I said, देखिए, there is a chart. वो chart के अंदर लिखा हुआ है that if this is the stage and this is the grade, remove this medicine, add this medicine, it's according to your body weight, etc. And there is immediate relief. And I said, this grade and stage has got nothing to do with you or me. ये डॉक्टर का काम है, let him handle it. आप क्यों तकलीफ कर रहे हो? And the way I tell them, it's his business. He has to decide कि वेट क्या है, ये क्या है, वो क्या है, ग्रेड क्या है, सब्ट्रैक्ट करता है, ऐड करता है, उसका डॉक्टर का काम है, आपका और मेरा नहीं है. So that gives them immense relief. And you're right about the stigma, because this lady had a 6-month-old child. She didn't want to touch it. She didn't want to touch her husband. She did not. She felt that, and she got to, her breast cancer was diagnosed because she was getting pain when she was feeding the child. She just pushed them away, and she was convinced that through the milk, the child would have gotten it. And if her husband touches her, he's going to get some kind of cancer. It took me 3 months. 3 months of daily talking, barring perhaps a Sundays in between, to get her out of that. And about 3-4 years later, she called me up to tell me that the younger guy is now 4 or 5, and that she's pregnant and she's delivering another child. She's just delivered. She didn't have time to call me up. She's calling from the hospital just to let me know. So they
Wow.
are humans. And if we just feel that connect between them and us, कि मेरी छोटी बहन है या मेरी माँ है, we can turn things around. That's what I do.
Sure.
Thank you for giving me the time to talk again and again. Thank you very much. Thank you, Dr. Shefali. And
Okay, thank you. Nice connecting. Thank you for having us. Yeah. Bye-bye.